Question 191. The nurse is caring for a client following a Billroth 2 procedure. On review of the post-operative orders, which of the following, if prescribed, would the nurse question and verify? A. Irrigating the nasogastric tube. B. Coughing a deep breathing exercises. C. Leg exercises. D. Early ambulation. Question 191. Answer: A. Irrigating the nasogastric tube. Question 191. Explanation: in a Billroth 2 procedure, the proximal remnant of the stomach is anastomosis to the proximal jejunum. Patency of the ink tube is critical for preventing the retention of gastric secretions. The nurse should never irrigate or reposition the gastric tube after gastric surgery, unless specifically ordered by the physician. In this situation, the nurse would clarify the order. Question 192. Risk factors for the development of hiatal hernias are those that lead to increased abdominal pressure. Which of the following complications can cause increased abdominal pressure? A. Obesity. B. Volvulus. C. Constipation. D. Intestinal obstruction. Question 192. Answer: A. Obesity. Question 192. Explanation: obesity may cause increased abdominal pressure that pushes the lower portion of the stomach into the thorax. Question 193. The nurse is reviewing the medication record of a client with acute gastritis. Which medication, if noted on the client's record, would the nurse question? A. Digoxin, Lanoxin. B. Indomethacin, Indocin. C. Furosemide, Lasix. D. Propranolol hydrochloride, Indril. Question 193. Answer: B. Indomethacin, Indocin. Question 193. Explanation: Indomethacin, Indocin, is NSAID and can cause ulceration of the esophagus, stomach, duodenum, or small intestine. Indomethacin is contraindicated in a client with GI disorders. Question 194. Which of the following tests is most commonly used to diagnose cholecystitis? A. Abdominal cord scan. B. Abdominal ultrasound. C. Barium swallow. D. Endoscopy. Question 194. Answer: B. Abdominal ultrasound. Question 194. Explanation: an abdominal ultrasound can show if the gallbladder is enlarged, if gallstones are present, if the gallbladder wall is thickened, or if distension of the gallbladder lumen is present. An abdominal cord scan can be used to diagnose cholecystitis, but it usually isn't necessary. A barium swallow looks at the stomach and the duodenum. Endoscopy looks at the esophagus, stomach, and duodenum. Question 195. The client with peptic ulcer disease is scheduled for a pyloroplasty. The client asks the nurse about the procedure. The nurse plans to respond knowing that a pyloroplasty involves: A. Cutting the vagus nerve. B. Removing the distal portion of the stomach. C. Removal of the ulcer and a large portion of the cells that produce hydrochloric acid. D. An incision and resuturing of the pylorus to relax the muscle and enlarge the opening from the stomach to the duodenum. Question 195. Answer: D. An incision and resuturing of the pylorus to relax the muscle and enlarge the opening from the stomach to the duodenum. Question 195. Explanation: Option 4 describes the procedure for a pyloroplasty. A vagotomy involves cutting the vagus nerve. A subtotal gastrectomy involves removing the distal portion of the stomach. A Billroth 2 procedure involves removal of the ulcer and a large portion of the tissue that produces hydrochloric acid. Question 196. While caring for a client with peptic ulcer disease, the client reports that he has been nauseated most of the day and is now feeling lightheaded and dizzy. Based upon these findings, which nursing actions would be most appropriate for the nurse to take? Select all that apply. A. Administering an antacid hourly until nausea subsides. B. Monitoring the client's vital signs. C. Notifying the physician of the client's symptoms. D. Initiating oxygen therapy. E. Reassessing the client on an hour. Question 196. Answer: B. Monitoring the client's vital signs. C. Notifying the physician of the client's symptoms. Question 196. Explanation. The symptoms of nausea and dizziness in a client with peptic ulcer disease may be indicative of hemorrhage and should not be ignored. The appropriate nursing actions at this time are for the nurse to monitor the client's vital signs and notify the physician of the client's symptoms. To administer an antacid hourly or to wait 1 hour to reassess the client would be inappropriate. Prompt intervention is essential in a client who is potentially experiencing a gastrointestinal hemorrhage. The nurse would notify the physician of assessment findings and then initiate oxygen therapy if ordered by the physician. Question 197. Which of the following tests can be used to diagnose ulcers? A. Abdominal X-ray. B. Barium swallow. C. Computed tomography, CORT, scan. D. Esophagogastroduodenoscopy, EGD. Question 197. Answer: D. Esophagogastroduodenoscopy, EGD. Question 197. Explanation. The EGD can visualize the entire upper GI tract as well as allow for tissue specimens and electrocautery if needed. The barium swallow could locate a gastric ulcer. A CORT scan and an abdominal X-ray aren't useful in the diagnosis of an ulcer. Question 198. Mucosal barrier fortifiers are used in peptic ulcer disease management for which of the following indications? A. To inhibit mucus production. B. To neutralize acid production. C. To stimulate mucus production. D. To stimulate hydrogen ion diffusion back into the mucosa. Question 198. Answer: C. To stimulate mucus production. Question 198. Explanation. The mucosal barrier fortifiers stimulate mucus production and prevent hydrogen ion diffusion back into the mucosa, resulting in accelerated ulcer healing. Antacids neutralize acid production. Question 199. The nurse instructs the nursing assistant on how to provide oral hygiene for a client who cannot perform this task for himself. Which of the following techniques should the nurse tell the assistant to incorporate into the client's daily care? A. Assess the oral cavity each time mouth care is given and record observations. B. Use a soft toothbrush to brush the client's teeth after each meal. C. Swab the client's tongue, gums, and lips with a soft foam applicator every 2 hours. D. Rinse the client's mouth with mouthwash several times a day. Question 199. Answer: B. Use a soft toothbrush to brush the client's teeth after each meal. Question 199. Explanation. A soft toothbrush should be used to brush the client's teeth after each meal and more often as needed. Mechanical cleaning is necessary to maintain oral health, simulate gingiva, and remove plaque. Assessing the oral cavity and recording observations is the responsibility of the nurse, not the nursing assistant. Swabbing with a safe foam applicator does not provide enough friction to clean the mouth. Mouthwash can be a drying irritant and is not recommended for frequent use. Question 200. A client with suspected gastric cancer undergoes an endoscopy of the stomach. Which of the following assessments made after the procedure would indicate the development of a potential complication? A. The client complains of a sore throat. B. The client displays signs of sedation. C. The client experiences a sudden increase in temperature. D. The client demonstrates a lack of appetite. Question 200. Answer: C. The client experiences a sudden increase in temperature. Question 200. Explanation. The most likely complication of an endoscopic procedure is perforation. A sudden temperature spike with 1 to 2 hours after the procedure is indicative of a perforation and should be reported immediately to the physician. A sore throat is to be anticipated after an endoscopy. Clients are given sedatives during the procedure, so it is expected that they will display signs of sedation after the procedure is completed. A lack of appetite could be the result of many factors, including the disease process,